the important points, and you are welcome to raise the queries at any moment of the presentation. So left heart failure, the common causes. What could be the common causes? The common causes could be the ventricular contraction is restricted, infarction, myocardial fibrosis, myocardial damage, or it could be restricted filling that can cause left-sided heart failure. So here there is a non-compliant ventricle could be there, that is commonly due to concentric left ventricular hypertrophy. It could be due to various kind of amyloid, glycogen, substance deposition. Increase afterload workload could be there. Afterload could be there due to systemic hypertension. So more of resistance. The heart is pumping blood against more of resistance. And there could be increased preload as well due to mitral regurgitation. So here, the important thing, the important events that happen is pulmonary congestion due to left arterial congestion. That puts a back pressure on the pulmonary circulation. So that leads to pulmonary congestion. Frothy sputum will be seen, exudate, transudate will be seen. So productive sputum, and it is it is generally transudate, and there is a pulmonary edema, and sometimes severe rupture can happen because of severe alveolar edema that can cause hemorrhage syndrome deposit, and there are lots of iron containing macrophages that gives rise to so-called heart failure cells. So you see rusty sputum in the patient, dyspnea, pulmonary edema, and you will hear inspiratory rackles in the bilateral rackles will be seen in both the sides, and there will be congestion that will be quite evident in both the lobes. And the important key facts that we'll see are there will be dyspnea, there will be orthopnea, so difficulty in breathing, and there is a congestion, and often getting up and just walking that relieves the symptoms. And it is more at night, because the night the venous return to the heart will increase because of decreased effect of the gravity. Blood thin sputum, rusty sputum, cyanosis. The pulmonary capillary wedge pressure rises due to pulmonary edema. Left-sided S3 heart sounds are seen. Mitral valve regurgitation is being noted, and there are pansystolic murmurs at the apex may be heard, which increases in intensity during expiration. These are the key features. PND, paroxysmal nocturnal dyspnea, as I discussed, this is the most common thing. And if you put a pillow over there, the venous return will decrease because of the effect of the gravity raised head. So that is an important maneuver in relieving the pulmonary congestion in left heart failure. Chest X-ray show permanent hilar congestion and diffuse congestion or batwing configuration like feature can emerge. Pleural effusion can also be seen in certain cases. And there are rusty sputum, alveolar macrophages are seen, as you can see over here. And there is a prominent congestion is being noted. Batwing configuration is being very well clear over here. And here you will see the so-called curly B lines. You see the curly B lines, which are the curly B, these are the curly B lines. These horizontal lines are the curly B lines. So lots of horizontal lines due to congestion will be seen. That is curly B line. So let's have a quick recap of left heart failure. That is very common, very high topic. Increased afterload, increased workload, myocardial infarction. These are the common causes. Common symptoms: pulmonary edema, paroxysmal nocturnal dyspnea, orthopnea, bilateral inspiratory crackles, left-sided abnormal S3 heart sound is heard. There is a lobar congestion, perihilar congestion. Treatment: how will you treat treatment of the underlying cause, and symptomatic management have to be done in these patients. Now let's do a MCQ to wrap up the presentation, and then we can take Q&A as well. 50-year-old man suffers an infarction of anterior left ventricular wall, receives therapy with antiarrhythmic and pressure agent, stable condition. He develops breathlessness. Echocardiogram shows a markedly decreased ejection fraction. Which of the microscopic changes is most likely to be present? So here it will be alveolar transudate, because there is a pulmonary edema is there. So here it will be alveolar transudate. That is a characteristic feature over here, because it is a characteristic feature of left ventricular infarction, which can cause acute left heart failure, pulmonary edema. So alveolar transudate is being seen. Here other things, this is not an exudate, and other fibrosis and all will not be seen. Pleural effusion can also be seen, but that is not there in option. So here alveolar transudate. So it can occur both in the intraalveolar area as well as in the pulmonary, in the pleural area also. There can be effusion. So here alveolar transudate is the right answer. So I will stop sharing now. And then now the question is open for discussion. The forum is open for the discussion. If you have any queries